Hi, Dr. Minkoff. My name is Gail.
Hi, Gail. Welcome.
Thank you. I came today because I have been diagnosed with breast cancer. I have a spot that I found in early May in my right breast. I went to see an oncologist. They want to do surgery, chemotherapy, radiation. It's not what I really want to do, so I want to know what my alternatives are.
Gotcha. Okay. So we look at this disease a little bit differently than the traditional oncologist does. The tools of the traditional oncologist are chemo, surgery, and radiation. And while sometimes that's effective, sometimes people don't want that kind of treatment. And so the way we look at it is we're trying to figure out, why did you get this? What are the factors that caused it? And then is there a way that we can restore the health of the immune system and deal with the cancerous cells at the same time? So I want to I made a little diagram here that I want to show you, because then it'll have you understand, like, why did you get this? You know, like, there's a lot of cancer these days, more and more people, even children. And something has changed in the environment that's caused cancer to be more common than it used to be. So if we look at this kind of little chart,
Yes.
H stands for healthy cell, and C stands for cancerous cell.
Okay.
So what happens between a healthy cell to transform into a cancerous cell? And basically, and this data was discovered in the late 1920s by, his name was Otto Warburg. He was a German doctor. He got a Nobel Prize for this work. Nobody's really improved much upon this work since until this time. And the basic idea is this, that in the healthy cell, there are little factories which make energy. Mm-hmm. And in order to make the energy, they have to have oxygen come in, and they have a source of sugar come in, and they combine the oxygen and the sugar. The sugar comes in through a door in the cell wall. And for most cells, it requires a hormone called insulin to open that door.
Okay.
So the sugar goes in, the oxygen goes in, it goes into these little factories, and then the cell makes something called ATP, which is the energy of the cell.
Okay.
So if it's a hair cell, it uses ATP to grow hair. If it's a liver cell, it uses it to detoxify or make a protein. Okay? And when this is working correctly, when an oxygen and a glucose combine, you get 36 of these ATP units. And that's enough energy so that the cell can do work. Through probably mostly a toxic environment, so toxins come into this cell. They damage these little factories called mitochondria.
Okay.
So that they don't work right. And they damage it to the extent where the cell can't use oxygen anymore to make energy. So the cell reverts to kind of a primitive state where it's what we call anaerobic. It's non-oxygen using. See, this cell is aerobic. It uses oxygen.
Right.
This one is anaerobic, meaning not using oxygen.
Okay.
And when it just uses sugar, it can only make 2 ATPs. The cell can't live right on 2 ATPs. And it starts to change. Okay? Either it's supposed to kill itself, but it doesn't do it. And it changes itself so that now it can live. Now, what it does is it starts making more doors where sugar can come in. So instead of one door, this is theoretically, but instead of one door where sugar comes in, now it can get in 10 doors where sugar can come in. Mm. And if it's got 10 doors, instead of only making 2 ATPs, it can make 20. Mm. And on 20 it can live. Now the cell does a lot of other things so that it can grow, and it loses. Normally these cells stay where they are. They're sticky. So a liver cell stays in the liver and a breast cell stays in the breast. But what happens with this is that these cells unstick, and they can send cells other places. And those are called metastases. Those are when the cancer isn't staying in your breast, like in your case, it's not just in your breast. It's in your bone, it's in your liver, and it's moved.
Mm-hmm.
And so now you have cells in those other places.
Right.
Okay? Now, when we look at this, we say, well, what could we do to sort of make this cell get stressed so that it wouldn't live as well, it wouldn't live as long, that it might even die? Well, the first obvious thing is if we don't have a diet that's high in sugar, then there's going to be less sugar for this guy, and he won't be able to live as well. This cell can live on fats, on proteins, and on sugar. This cell can't live on fats. It lives on sugar. Now, the body can transform proteins into sugar, but generally, if we put someone on a very low sugar diet, now I don't know if the oncologist talked to you about diet, but usually oncologists don't care too much about diet.
Right.
But in our case, we generally put people on a diet which is called ketogenic. It's very low in sugar because we want to stress this cell and not give him sugar so that he doesn't grow as well. Now, in studies in rats where they take breast cancer tumors and they transplant them into rats and then they put the rats on this diet, the tumors shrink and die. So in humans, it doesn't work as well, but we think that it helps. So we put someone on a very low sugar diet. It's called a ketogenic diet, and our dietitian will go through that with you. Okay? Now, the other thing that this cell doesn't like is it's a low energy cell. It works on low energy because it just can't make it.
Right.
So if we used a technology which is called pulsed magnetic field, we can charge up the membrane on this cell. And when the membrane charge is higher, it doesn't divide as well or as fast. Okay? So I'm just kind of going through some of the stuff we do to try to make this situation better.
Okay.
Okay? The other thing is that we use ozone, which is a form of oxygen, because these cells don't like oxygen. In fact, if you put ozone on these cells, they will die. Okay? So we have various ways to deliver ozone safely to the body so that the cell gets a lot of oxygen and it doesn't like that. Okay? These cells are often usually sensitive to heat. They don't like heat.
Okay.
So hyperthermia means high heat. So where a tumor is localized, we have something where we can apply high heat where it doesn't burn the normal cells, but it heats these cells up to as high as 106, and they don't do well with heat. So we're trying various ways to stress them, deprive them of sugar, give them oxygen, put heat on there so that they're stressed, and then hopefully they'll die. Okay? Now, the other way we do this is that these cells, the genetics in these cells is abnormal. And there are certain herbal treatments where we can alter the genetics, where we either cause the cell to go back to normal or it will cause the cell to die. And we can test this. So one of the first things that we do when we have someone come in is that we send some blood to a laboratory which can actually take the tumor cells that have gotten out of the tumor and into the blood. They're called circulating tumor stem cells. These are the toughest ones of the cancer. And they can take these cells and they can grow them up in tissue culture. So they can have all bunch of them. And then they can see what is this cell sensitive to, what will kill it. And this is a printout of 2 different kinds of chemotherapies. This kind is very common, and you can see there's about 30 different pharmaceuticals that do this.
Right.
But this tells us which ones of these have the best kill on that cell. See, some of these don't work very well. The graph is low.
Right.
Some of them work really well, like this top one is 83%. So if we put these cells in a dish and we add this chemotherapy, 83% of the cells will die. Okay? So usually we can find 3 drugs that will kill 80% or more.
Okay.
And then we have a special way to deliver that, which I'll tell you in a minute.
Okay.
Okay? The other thing that this test will do is it will test natural agents against the tumor cells. Okay? So like vitamin C and turmeric, and there's about 50 different ones. Garlic and broccoli extract and things like that.
Okay.
So if you go on the internet and you find, oh, there's 100 things, someone took something and it cured their cancer, some herbal thing. Well, what we want to know is in your cancer, which ones do we pick, and based on which ones are the most sensitive.
Okay.
And so we use those. So you can see that now the natural ones aren't as strong as the chemo ones, but they're also much safer because there's no side effects.
Okay.
So in this one, vitamin C kills 35% of the tumor cells.
Oh, okay.
And so we can give vitamin C intravenously in high doses. If you had a cold, you might take 500 milligrams or 1,000 milligrams or 5,000 milligrams. But we can give up to 100 grams, like 100,000 milligrams intravenously, and the body tolerates it well. The tumors don't like it.
Okay.
It also boosts immunity.
Okay.
Okay? So we get a list of these things. Some of these are given intravenously, some of them are given orally. So we do a program for that.
Okay.
Okay? Now, the other thing I want to talk about is if we decide to do chemotherapy, we're not delivering it in the traditional way that it would be given.
Okay.
The traditional way is the oncologist will calculate based on your height and weight how much drug you should get. Okay? And the idea is to give you as much as you can tolerate to try to kill as many tumor cells as possible.
All right.
Okay? Now, a grape-sized lump, has almost 1 trillion cancer cells.
Oh, wow.
Okay? So 1 trillion is 10 to the 12th power. And let's say the drug will kill 99%, not 83%, but let's say it would kill 99% of those cells. So if you kill 99% of 10 to the 12th power of cells, you're still left with 10 to the 10th power of cells. Billions, tens of billions. Okay? Well, let's say you do it again and you kill another 99%. You're still left with many millions. Okay? So there's a lot of tumor tissue left even when you do maximum chemotherapy.
Okay.
The problem with it is that the cells in our body, which are fast growing, hair cells, cells lining your mouth and your intestine, bone marrow cells, they're getting this full dose too. And they get hit too. And it suppresses the immune system tremendously, or it causes ulcers and hair to fall out and all these side effects. Okay? Now we know that chemotherapy does not kill the circulating stem cells of the tumor. It doesn't kill it.
Okay.
So you're always left with circulating stem cells. And normally it's our immune system that's able to handle these things, that kills these things. But if there's no immune system left, when you're done with this, the circulating stem cells can grow and the tumors can come back. And that's the problem. So what we're trying to do is keep our feet in both worlds, is to give chemotherapy but also preserve the immune system. Okay? Because without the immune system, you're going to have trouble. Okay? Most people who get chemotherapy, who have late stage cancer, they don't actually die of their cancer. They die because their immune system fails. Okay? And they get an infection. Okay? Or they waste away. So we know that if we can give some chemotherapy, we can help, but only if we can preserve the immune system at the same time.
Okay.
Okay? So a very bright doctor in Mexico about 50 years ago discovered that one of the things that you could use, that a tumor cell does, that you could use against it, is the tumor cell has lots of doors where sugar can come in. And he discovered a therapy which is called IPT, that stands for insulin potentiation therapy, that if you gave somebody insulin, you could open up 10 doors on this cancer cell, and the one door on this cancer cell where sugar comes in would open. So then he calculated if he gave only 10% of the normal dose of chemotherapy, and it was used with insulin, you could get this cell to take 10 times as much as this cell of the chemotherapy. Okay?
Okay.
So the healthy cell can usually handle 10% without making the body anemic or the white blood cell count going down or the hair falling out. Okay? But this guy's getting 100%. And so we have a way to sort of preserve this and do maximum damage to this. So if we do a 10% dose of chemotherapy and high heat and oxygen and pulse magnetic field and herbs, we have a better chance to hurt this cell but to keep the immune system going. Okay? I have a patient who's a physician who got cancer. His wasn't breast cancer, his was colon cancer. And he was 53 years old, and he said, he was going over and over in his mind, well, how did I get this? And he went to his oncologist and he said, why did I get cancer? Like, what happened to me? And the oncologist said, well, your immune system protected you. So then the physician said to him, but all of your therapies, when I'm getting high-dose chemotherapy, are going to harm my immune system. How's my immune system going to fight back, or if that's what's kept me from getting cancer all these years, if you do damage to it? And he said that has yet to be figured out. So what we're trying to do is figure that or do that thing at the same time.
Okay.
Now, the statistics, and they come from Las Vegas from an oncologist who's been doing these therapies for the longest time. And he has about 800 patients that had stage 4 cancer. So that means it's all over the place. It's like your cancer. That he has treated that have been living more than 5 years. And his statistics show that it's a little bit in the high 50% are still alive at 5 years. In traditional treatment, the statistics are way, way less. Okay? It's probably in the neighborhood of 5%, but it varies with the cancer. There is a published study from a cancer journal that if you add chemotherapy done in the regular way, it only improves survival for 5 years by about 2.1%. Okay? So we know that if we can do both things, we get possibly a better chance. There's no guarantee in this business because bodies are funny and cancer is very funny. Okay? Now, the other thing that we're trying to do at the same time is if this is caused by toxins, these are toxins that you've been exposed to from chemicals, pesticides, heavy metals. They come in through food, they come in through breathing, they come in through the atmosphere, they come in through cosmetics that are in your body already. There's also a source of chemicals in the body, in your own intestine. These may be parasites or funguses or bad bacteria that produce toxins. We know that people who have gum disease, that there's bacteria around their gums that produce toxins. That people who have root canal teeth may have toxins coming from the root canal teeth. That these add to the toxin load. And the toxins suppress the immune system. Okay? And that's how you got from cancer, from healthy to cancer in the first place. Okay? Probably 80 or 90% of the time. That's what the underlying cause is. Okay? So we do detoxification at the same time. We try to fix the intestine, get rid of the parasites and funguses. Sometimes hormone treatments help. Okay? So we can get the hormones up. If your adrenal gland is very stressed and you don't have much energy, that we can support hormones if they're too low. Okay? And then in the detoxification process, by getting these toxins out of you and cleaning up your gut, your immune system will work better, and your immune system then won't have 8 wars fighting, like it's got a parasite and a fungus and a bad tooth and the cancer. Is that if we can get these things fixed up, then it's just fighting the cancer, and it gives us a better chance.
Okay.
So this treatment is a holistic treatment. We're trying to consider the whole person and the problems that their body has, and we're trying to deal with those things so that we can get a better chance at getting you over this hump and getting you better. And so that's the idea of it, and the specifics of it we'll get into later. But that's how we look at it. And now sometimes people combine regular treatments with our own treatments, IV vitamins and minerals, detoxification, pulse magnetic fields. We're basically open to help the person in the way that they want to be helped. So we don't have a fixed cookie cutter. Each person is different. Our goal is to help and support that person maximally so that they can do what they want. I found that when a person believes in a treatment, that's the treatment that they should do. If they saw the oncologist and he said, this is the way you should do it, and you're sold on that, we will do everything we can to help you. Our diet interventions and supplement interventions can help. If the person says, gee, I don't want that, I don't think that's the right way for me, we can go all this way, we'll go all this way. Okay? So that's the overview, and now you can ask me some questions, and we can go from there.
Okay, great.